Hi, my name is Maria Perez-Rojas and I'm a respiratory therapy student at Miami-Dade College Medical Campus Center. Today's topic is going to be about PAP as an adjunct of bronchial hygiene therapy, and the equipment I'll be using today is called EzPap. PAP stands for positive airway pressure. Before I get into the procedure, let me address some important details about this therapy, such as indications, contraindications, and possible complications and hazards. EzPap is indicated to reduce air trapping in patients with asthma and COPD, to help mobilize retained secretions in patients with cystic fibrosis and chronic bronchitis, to prevent or reverse atelectasis, and to optimize the delivery of bronchodilators in patients receiving bronchial hygiene therapy. On the other hand, EzPap is contraindicated in patients unable to tolerate the increased work of breathing, intracranial pressure greater than 20 millimeters of mercury, hemodynamic instability, recent facial, oral, or skull surgery, esophageal surgery, untreated pneumothorax, epistaxis, and acute sinusitis. As any other medical procedure, EzPap has its possible complications and hazards. These are the increased work of breathing, leading to hypoventilation and hypercarbia, increased intracranial pressure, cardiovascular compromise, and air swallowing, increasing the likelihood of vomiting and aspiration. All right, first thing to begin my therapy is to verify in my patient's chart the physician's order for EzPap. Before I walk into the room, make sure to knock on the door and wait for authorization to come in. Then I'll introduce myself as a respiratory therapy student, and I'll explain the nature of my visit in terms that my patient or his relative will understand. Hi, Ms. Sanchez. My name is Maria. I'm a respiratory therapy student, and I'm here today because the doctor prescribed EzPap to help you mobilize your secretions. Before you attempt to do any patient assessment, make sure to perform hand hygiene by washing your hands no less than 15 seconds or utilizing the alcohol-based hand rub, which for these video purposes, I'm only gonna verbalize. Once you're done with hand hygiene, proceed to don the appropriate PPE, and in this specific procedure, we're only gonna use gloves. Make sure to verify your patient's identity using two identifiers. This can be name and medical record number. Then you can go ahead and take your patient's vital signs. These are respiratory rate, heart rate, blood pressure, temperature, SpO2, and breath sound, which I'm only verbalizing as well. Then we can proceed and start the therapy. For this therapy, we're gonna need the EzPap, as I mentioned earlier, and which you should have gathered prior coming to the patient's room, an oxygen tubing, and a nose clip also are going to be necessary. This equipment consists of a manometer, which will tell me if the patient is achieving an airway pressure of 10 to 20 millimeters of mercury, centimeters of mercury, and a filter or a mouthpiece. I'm gonna go ahead and connect my oxygen tubing to the flow meter. It can be either oxygen or air, it doesn't matter. And the other end, I'm gonna go ahead and attach it to the equipment. Okay? Then I'm gonna attach the mouthpiece. And then I'm gonna go ahead and instruct my patient how to use the equipment and how to go through the therapy. First thing I'm going to do is to position my patient in the correct position. Ms. Sanchez, I'm gonna need you to sit up straight and comfortably. Hold this for me, please. Then this is what we're gonna do. You're gonna form a tight seal around the mouthpiece. You're gonna inhale from your diaphragm to a volume greater than your tidal volume, but not to your total lung capacity. Then at the end of inspiration, you're gonna exhale through the one-way valve, and you're gonna try to achieve 10 to 20 centimeters, an airway pressure to 10 to 20 centimeters of mercury. You're gonna try to make exhalation to last 3 times longer than inhalation. And you're gonna do 10 to 20 breaths, followed by 2 to 3 huff coughs to clear those loosened secretions, all right? I'm gonna place this clip on your nose. This won't hurt. You might feel a little bit uncomfortable, but this is just to make sure that all air is coming through her mouth and nothing is leaking through her nose. Okay, let's do it together. And also, very important, turn your flow meter at 5 liters per minute, all right? Okay, let's do it together. Tight seal around, inhale, and exhale. Very important to let your patient know it's actively and not forcefully. Gently blow, blow a little more, 10 to 20 centimeters of water, and a good exhalation. Good, very good. Very important also to let your patient know that this cycle is to be repeated 4 to 8 times during 10 to 20 minutes. And if there is any expectoration, you should note sputum for odor, color, viscosity, and quantity. Then you can go ahead and perform post-treatment vitals, and then ensure patient's safety and comfort. Ms. Sanchez, we're done for today. You did very good. Is there anything else I can do for you?
No, thank you.
All right, then remove your PPE. Discard it. Perform hand hygiene and document your therapist's findings in the patient chart. This has been a video on PAP as an adjunct of bronchial hygiene therapy. I am Maria Perez-Rojas, and I hope you found this material helpful. Thank you for watching.